Mr. Speaker,
Recognized and Peter.
thank you, Mr. Speaker. Mr. Speaker, we don't rise today, but at social distance we're sitting, and I'm in full support of the resolution pursuant to Section 22 of the Constitution of Antigua and Barbuda, approving a state of emergency. This resolution, Mr. Speaker, is timely and it is extremely important in bringing government's responsibility for management and control of this dangerous crisis. It is therefore a distinct honor, Mr. Speaker, and privilege to participate in the first ever virtual meeting of the Parliament of Antigua and Barbuda, a testimony for the history books for the far-reaching governance consequences of the severe public health and socio-economic crisis visited on us by this coronavirus COVID-19 pandemic. Mr. Speaker, I would like to thank the government of Antigua and Barbuda, especially the Prime Minister and the Minister of Health, the Honourable Member for St. Mary's North, for their proactive, decisive, courageous, caring, and people-centered leadership that has inspired purpose, dedication, commitment, and exemplary solidarity in the national response. The COVID-19 is affecting more than 780,000 people in 200 countries, and more than 37,000 people have died, and more than 165,000 have recovered so far. Mr. Speaker, this pandemic is very serious. It requires us to avoid panic and to act responsibly, as the Honourable Prime Minister said this morning. Antigua and Barbuda is fortunate so far to only have 7 cases of COVID-19 after recording its first case 19 days ago on March 12th. But there is no doubt that our resilience will be challenged like never before, not just in combating the spread, but in how we turn this period of uncertainty and adversity into advancement opportunities. Excuse me. I would like to take this opportunity, Mr. Speaker, to thank all the healthcare providers, the public officers, and the patriots of our land, sacrificing on the front line of the fight against the invisible killer. I thank their families for the blessing of their services above and beyond the call of duty. But my heart goes out to those who have lost loved ones around the world, and I empathize with victims of the virus who are recovering or fighting for their lives. Mr. Speaker, as we stepped up border protection to prevent entry into the early months of the year, we all hoped and prayed that COVID-19 would leave us alone. We were not that lucky. Now that it is with us, our collective effort must be, Mr. Speaker, of necessity, be all about focus, discipline, containment of the spread, identify, isolate, and treat disease effectively to keep mortality as low as possible. And in this regard, a severe challenge faces our healthcare system, which could be overwhelmed with too many cases too quickly. There's no question, Mr. Speaker, that our healthcare system needs additional capacity for effective management and control of this pandemic. More doctors, more nurses, more testing equipment, special isolation units, more hospital beds, more ventilators, more personal protective equipment, adequate medical supplies, epidemiological surveillance systems to detect outbreaks at community level, and the quarantine facilities. I commend the government so far for all what they've done. I also commend the government and the Prime Minister and the Cabinet for spending nearly $20 million so far. But in addition to the significant amount of money needed to rapidly improve the readiness of our healthcare, to meet the COVID-19 challenge, we need money for relief of our people, the restoration of their livelihoods, and the recovery of the severely battered economy. That is why, Mr. Speaker, I posit today in this Honourable House that the private sector and civil society organizations must now come to the assistance of the government of Antigua and Barbuda. That is exhausting public funds on the priority of fighting COVID-19 at a time when the same pandemic has brought national income from the vital tourism industry and other sectors to a gruesome standstill. Antigua and Barbuda needs its wealthy citizens, its profitable companies and progressive civil society organizations to establish now, at least in the first instance, a 50 million EC dollar fund to help the government meet the burdensome cost of the country's response to the COVID-19 pandemic. Sorry. Mr. Speaker, I know that this may be a little controversial and contentious, but I say so without fear or favor. All those wealthy homeowners at Jumbi Bay, Mill Reef, Galley Bay, Jolly Harbour and elsewhere in this country who have enjoyed millions of dollars in tax concessions, duty-free, stamp duty waivers, and relief over the years from the government of Antigua and Barbuda and the taxpayers of this country. All those business persons who have enjoyed very lucrative government contracts, and I won't call any names, but Mr. Speaker, in some instances, monopolistic and exclusive government contracts. They need now more than ever to step up to the plate and to be good corporate citizens in this country. Mr. Speaker, I recall after Hurricane Irma that devastated Barbuda, that the Honorable Prime Minister Gaston Brown and myself donated very generously of our personal resources. My family gave EC $540,000 to the Barbuda Relief Fund. But the truth is, and the reality is, Mr. Speaker, that others, much more wealthy in this country, and they know who they are, than both the Prime Minister and myself, they gave very little. If they gave some, gave absolutely nothing. But as John F. Kennedy have said, and I quote, we all know it, ask not what your country can do for you, but what you can do for it. End of quote. Mr. Speaker, the time has come for us to share our many resources with the state, our fellow citizens and residents. We now have to more than ever be our brother's keeper, where we will beat the virus, but only with the collective action, as the Prime Minister and Honourable Minister of Health said. And I call on all the citizens of Antigua and Barbuda in general, and the citizens of my dear beloved constituency, St. Peter's, in particular, to follow the rules of engagement in the battle against COVID-19. Follow the rules espoused by the Ministry of Health officials. Keep your mind and body and surroundings clean. Wash your hands frequently and thoroughly with soap and water. Cover your face with a tissue or your elbow when coughing or sneezing. Then throw the tissue safely away in a waste bin. Maintain social distance. This is one of the most important things, Mr. Speaker. I have to repeat it because it's important. Isolate yourself, avoid traveling and gatherings, stay at home. Social distancing is not a punishment. We need to realize that. It is an opportunity to use rest, silence, solitude, meditation tools for personal repair, self-renewal and growth, and even to become closer with your God. Build up your immunity to disease by eating healthy food, exercising regularly and sleeping properly, getting at least 8 hours sleep a night. My dear constituents and residents of Antigua and Barbuda, we got to take care of ourselves. You got to take care of yourself, your loved ones. Be supportive, be careful, be alert, be loving now, and be kind. So far, Antigua and Barbuda has done extremely well in the battle against this novel coronavirus. The government has done extremely well. Although I'm not in the cabinet, I'm in touch with my colleagues, the Prime Minister, the Honourable Minister of Health, and other cabinet colleagues to lend my support at this time of crisis. But there's a lot more to be done. In these times of encircling gloom and doom, Mr. Speaker, let us find the silver linings, the bright lights of hope. Let us care for each other. Let us share with each other. Let us use our togetherness to fight and prevail over the catastrophe of COVID-19 that now encircles the world. But before I end, Mr. Speaker, I would like to give the greatest kudos and gratitude to all the frontline workers, the Honorable Prime Minister, the member for St. John's City West, who is leading from the front, the Honorable Minister of Health, the member for St. Mary's North, the Honorable Malvin Joseph, the unrelenting Chief Public Health Officer, Dr. Rhonda Seeley Thomas, the Chief Immigration Officer and her staff, the doctors, the nurses, the Commissioner of Police, Mr. Atlee Rodney, and all the policemen on the front line, Colonel Talbot Benjamin, the new commander, and the Antigua and Barbuda Defense Force, and all the countless workers, Mr. Speaker, have been risking their own health to keep the rest of us healthy and alive. In fact, the police have shown that they can handle breaches of peace, curfews and gatherings. They've been doing a great job so far. For example, how they handled the overcrowded church at Boland's and breaking up the beach party at Deep Bay. I commend them. Another area that I think the government should give guidelines is the matter of the pandemic leave, Mr. Attorney General. I'm very pleased, Mr. AG, that we have gone the way of Grenada, BVI, Turks and Caicos, and some others, Mr. Prime Minister, and now you have declared a 24-hour, 7-day shutdown of the country. I fully support it. But the reality is, Mr. Speaker, shutdowns will wipe out some small and micro businesses, many of which have no cushion to see them through periods of no business. The employers and business owners should not have to bear the full brunt of the shutdowns. I know this may not be politically palatable to most, but the employee should be forced to take his vacation leave, Mr. Attorney General, during the periods of shutdown of the businesses before the employer is forced to pay pandemic leave. I hope the government looks favorably on this. There's only fear that the government, employers, and employees, all three, make sacrifices to help us all in the end. Also, I hope that this total shutdown will not affect large supermarkets, who has millions of dollars in frozen goods and will require their maintenance men to continue monitoring their air-conditioned systems and their refrigeration systems. But I'm sure in committee stage that the Honorable Prime Minister will expound on that. Mr. Speaker, in concluding, I just want to say that the Grenada Health Minister, Minister Nicholas Steele, I believe is his name, in addressing the people of Grenada last night while introducing stiffer measures, and I quote from him, he said, "Every time you break or ignore guidelines to quarantine when you've been exposed, you're potentially taking the life of one of our citizens. Maybe you're prepared to take that gamble, but unfortunately, it is not only to your detriment. You are endangering the lives of each of us." End of quote. Health Minister Nicholas Steele said in a radio and television broadcast on Sunday night, and I quote again, "Lives at stake. Your life is at stake. Your grandmother's life is at stake. Your father's life is under threat. My life and that of my family are under threat, and so is my neighbor's. Whole families stand to be wiped out, from the halls of the palace to the seat of prime ministers and presidents, to the village slums of the world. COVID-19, Mr. Speaker, has shown that it respects absolutely no one." End of quote. I commend this resolution and fully endorse and support it. Thank you very much, Mr. Speaker.